Hypertension, commonly known as high blood pressure, is a chronic disease with far-reaching impacts on society. Defined by the World Health Organization in 2023 as persistently elevated blood pressure beyond normal limits, it is a global burden affecting individuals, communities, and healthcare systems alike. In the context of the Philippines, cardiovascular diseases is the leading cause of morbidity and mortality according to the Journal of the Asian Pacific Society of Cardiology in 2023. Hypertension with blood pressure readings of 140/90 mmHg or higher, according to Puyawan in 2020, has been the primary cause of cardiovascular-related deaths for over 3 decades in the study of Mercado et al. 2022. Recognized globally, hypertension transcends geographical, social, and cultural boundaries, affecting people from all walks of life. In the Philippines, the situation is nearly concerning. Nearly half of the hypertensive population remains unaware of their condition, with only 27% managing to keep their blood pressure under control, and that is according to Catral et al. 2024. The common complications, stroke, ischemic heart disease, chronic kidney disease, and hypertensive retinopathy, underscore the severity of this issue. In Central Visayas, hypertension is the most prevalent illness, with approximately 10,400 cases reported according to Statista 2024. Furthermore, the Department of Health in Central Visayas highlighted that heart diseases were the leading cause of death for the first 9 months of 2022. Specifically, in Barangay Talay, Dumaguete City, hypertension remains a pressing public health concern. The research aims to bridge gaps in awareness, assist local health officials and policymakers in crafting targeted interventions, and empower residents to actively engage in managing their health.
Hypertension or high blood pressure is a primary global health concern affecting millions worldwide. Its prevalence is increasing due to various factors including aging populations, urbanization, and unhealthy lifestyle. Research confirms the widespread impact of hypertension, with predictions indicating that by 2025, over 1.7 billion people, or 31% of the global population, will be affected. According to the World Health Organization, the Philippines has been paralleling global trends in the prevalence of hypertension. Multiple risk factors contribute to hypertension. According to the National Heart, Lung, and Blood Institute, these include age, family history, genetics, lifestyle habits, other medical conditions, race, sex, and socioeconomic factors. Addressing the risk factors requires a comprehensive approach, including education and awareness campaigns. According to studies, adults with higher educational attainment have better controlled blood pressure. However, knowledge alone is not enough. Attitudes towards hypertension play a crucial role. Negative attitudes and lack of awareness about the disease can lead to non-compliance with treatment. Lifestyle modifications such as reducing alcohol intake, increasing physical activity, and maintaining a healthy diet are essential for managing hypertension along with medications. While medications are crucial, lifestyle modifications significantly manage hypertension. Despite these efforts, barriers to effective hypertension management persist. Disparities in hypertension control between low and middle income countries and high income countries highlight the need to address these obstacles, particularly in resource limited settings. Lack of disease awareness, negative healthcare experiences, and limited access to care are among the challenges faced in controlling hypertension globally.
Our project targets alta presyong kontrahon progresibong aksyon sa kalawasan buhaton, focuses on assessing and addressing hypertension among the senior residents of Barangay Talay who are the partners for the project. The main goal was to improve community health outcomes and increase awareness about hypertension management and prevention. The objectives include identifying environmental factors affecting health, presenting health survey outcomes, conducting health teaching sessions, introducing a fitness program, and assessing learning outcomes through the survey. The project involved several phases: planning, community entry, conducting baseline service and laboratory tests, health teaching sessions, and the exit phase. The proponents first engaged the community through courtesy calls and meetings with local leaders, ensuring their commitment and participation in the project. Laboratory diagnosis and health difference surveys were conducted to provide cases and aid in identifying the predominant problem within the community. Hypertension is the primary issue identified through the problem identification and prioritization matrix, additional analysis to identify causes and solutions. The proponents conducted health teaching, health promotion, and physical fitness activities. This helped correct misconceptions about hypertension and encouraged the community to take preventive measures to control blood pressure. The project culminated with the launching of a fitness program which aimed to reduce sedentary lifestyle among senior citizens through aerobic exercises, which have a significant impact in controlling blood pressure, according to Offsite 2020. The proponents conducted social marketing through posters, brochures, and social media publication materials. These informational materials were endorsed to the community in hopes of spreading awareness beyond the target group. Interactive activities also took place to celebrate the completion of the project. Subsequently, the proponents provided certificates.
For the project framework, depicted through a logic model begins with essential inputs, a contribution from the organizer and a cash assistance from the Office of the Student Services. Adopting the service learning model approach, organizer underwent training that includes lecture, assessment, and practical examination of various laboratory tests, equipped with necessary laboratory materials, pre-entry community preparation, and a predetermined venue. Lastly, organizers ensured an effective collaboration with the barangay for a seamless information dissemination. The project activities commence with a series of thorough survey encompassing household health, baseline, ocular, and pre- and post-cap survey. In addition, a range of complementary laboratory services were made available to the community, which are listed below. These interventions were crucial for planning and understanding the community's health status. During the planning process, a community assembly was held to present the survey and the test result. Through a community-centered approach and a problem and project identification and prioritization matrix, hypertension was identified as the primary health concern. Consequently, a fitness program incorporating physical activities and information drive was chosen as the intervention strategy. Health education session on hypertension covered its definition, symptoms, causes, risk factors, prevention, and emergency responses. Utilizing social marketing tools such as brochures and posters, the project enhanced participants' understanding and retention on crucial health information. The project's culmination phase highlighted a significant outcome, with the post-cap survey showing an improved community in knowledge, attitude, and practices, and Zumba session launched the fitness program with an informational poster and brochures about hypertension and the importance of exercise were posted and distributed to ensure sustained health awareness.
Following that, we will be discussing the household baseline survey. The survey contained a total of 38 questions aimed at gathering comprehensive data on health determinants such as socio-demographic factors, socioeconomic status, and etc. The senior citizen organization of Barangay Talay comprises of 263 members, making it an integral part of the community. For the survey, 40 seniors were interviewed. Of these, 67.5% were female and 32.5% were male. This representation is important because according to a study by Song et al. In 2020, postmenopausal women face higher hypertension risks due to hormonal changes. This is the age representation of the surveyed seniors, and it shows a relatively younger population. Age is crucial in hypertension as risks typically increase with age due to the physiological changes in blood vessels. For educational attainment, the surveyed seniors had a diverse educational background. This variety can impact hypertension risks as higher education levels are often linked to better health literacy, healthier lifestyles, and improved access to healthcare. Knowing this would allow us to gauge the health education activities effectively. The participants were also asked for their work locations. Most surveyed seniors, or 57%, had incomes below 12,030 pesos, with 20% earning between 12,030 pesos to 27,060 pesos. According to the 2021 income classification from the Philippine Institute of Developmental Studies, most seniors are classified as low income. Low income levels can lead to higher stress levels and limited access to resources, as shown in a study by Quinn et al. In 2022. This may increase the risk of hypertension due to the challenges in affording healthcare and managing hypertension. The participants were also asked their monthly expenses and home ownership. When asked about healthcare preferences, 72% of seniors chose doctors, with a small percent opting for mananambals. The participants were also asked for their beliefs and practices on health. Moving on to family structure and heredity, a notable finding is that 42.5% of seniors reported a common genetic disorder within their family. The most prevalent health issue were high blood pressure affecting 35% or 14 individuals and diabetes affecting 20% or 8 individuals. Participants were also asked if they also discussed their health history with their healthcare providers, with 72.5% indicating they had done so. They were also asked about their awareness and familial habits such as smoking, diet, and exercise that might affect their health, with only 52.5% acknowledging these connections. Next, over half of the participants stated that their family health history had influenced their health decisions. The overall health status of seniors indicates a mix of perceptions. Additionally, 22.5% reported having diabetes and 32.5% reported high blood pressure. The distribution highlights the potential areas where health interventions could be beneficial. Participants were also asked about their average hours of sleep. According to Lopez Jimenez in 2022, getting less than 6 hours of sleep is known to be detrimental to overall health and can lead to high blood pressure. While 15 participants reported having 8 to 9 hours of sleep, the 24 who reported less than the optimal amount is a cause for concern. Lastly, seniors in Barangay Talay reported that 85% engaged in physical activity for at least 2.5 hours a week, and 77% abstained from consuming alcohol and cigarettes. These findings underscore the predominant trend toward a healthy lifestyle among the seniors. The seniors were asked about the satisfaction levels with accessibility, quality of healthcare services, and ease of access to healthcare services in Barangay Talay. A majority indicated a generally positive perception and reported no difficulties in accessing the healthcare system. No significant issues were reported regarding access to functional toilet systems, waste segregations, pet ownership, or mosquito breeding sites. A majority indicated positive perceptions regarding the promotion of health awareness, accessibility of healthcare facilities, environmental protection policies, and policies related to peace, health, and environment in their community. However, when asked about personal experiences with healthcare access barriers due to political or policy-related reasons, responses were varied. While 47.5% of respondents reported that they had not encountered challenges, a significant portion, or 52.5%, expressed neutrality or reported having struggles with healthcare, suggesting diverse experiences and perceptions among the respondents.
Good day, panelists. My name is John Linzalor, and I'm here to discuss the presentation of the results. Knowledge, attitudes, and practices, or the CAP survey, was utilized before and after the health teaching. The results were recorded and tabulated as follows. Knowledge-based questions have three options: tinuod or true, sayop or false, and wala ko kabalo or I don't know. Tinuod was assigned a value of 1, sayop was -1, and wala ko kabalo was 0, with the exceptions of questions number 2, 4, and 5, as the values for these questions were inverted. The mean for the pretest was 5.3, which increased for the post-test to 9. The modes for both the pretest and post-test questions was 1 or tinuod. Attitude-based questions have 5 options: moyon kaayo or strongly agree, moyon agree, wala ko kabalo or I don't know, dili moyon disagree, and dili jud ko moyon or strongly disagree. Moyon kaayo was assigned a value of 5, moyon was 4, wala ko kabalo was 3, dili moyon was 2, and dili jud ko moyon as 1. The mean for the pretest was 43.27, which increased for the post-test to 47.77. The modes for both the pretest and post-test questions was 5 or moyon kaayo. Practices-based questions have 3 options: kanunay or always, usahay or disagree, and dili gyud or never. Kanunay was assigned a value of 2, usahay was 1, and dili jud ko moyon as 0. The mean for the pretest was 12.03, which increased for the post-test to 15.76. The mode for the pretest was 1, or usahay, and the mode for the post-test was 2, or kanunay.
Good day everyone, today I'm going to present to you the key findings of the project and their implications. In our initial assessment, we pinpointed the areas where senior citizens struggled most in understanding. So these areas were particularly regarding blood pressure norms, the importance of exercise, and alcohol's effect on blood pressure. So these topics also consistently garnered incorrect or uncertain responses, potentially due to inverse question phrasing. So moving on to the implications of our findings, following our educational sessions, there was actually a notable 70% increase in hypertension management awareness, especially those with higher education levels. So this aligns with research by Himmelfarb Health Sciences Library and Islam et al. In 2021, implicating education's role in dispelling misconceptions and engaging individuals with health information. So additionally, there were positive shifts in attitudes towards hypertension management, exemplified by a significant increase in understanding the limitations of relying solely on food supplements and combating health-related misconceptions. Statistical analysis also further confirmed these changes as statistically significant, reinforcing previous studies findings by Islam et al. And Racy et al. 2021. Moreover, post-education evaluations revealed substantial progress in hypertension management practices, with participants showing a significant 31% increased adherence to recommended practices. This implies the effectiveness of health education programs in enhancing self-management behaviors as supported by Budovich et al. Study in 2020. In conclusion, our intervention improved the knowledge, attitudes, and practices regarding hypertension management, aligning with Adiola and Oliveros et al.'s emphasis on health education's crucial role in fostering healthier lifestyles.
The project components were assigned with the senior citizens of Barangay Talay as their community. They focused on hypertension and offered health education to address the problem. A health baseline survey revealed high blood pressure as a chronic health condition among 32.5% of the respondents and a prevalent family health issue among 35% of the senior citizens. The results of the said survey and community diagnosis reflect the community's identified problem that serves as the basis for the health teaching topic. 2 CAP surveys about hypertension were taken, a pre-CAP before and a post-CAP after health teaching. The pre-knowledge part of the survey had a mean score of 5.3, increasing by 70% in the post-knowledge with a mean score of 9. The pre-attitude scores had a mean score of 43.27, which became 47.77 in post-CAP with a 10% increase. Finally, the pre-practices section of the survey had a mean score of 12.03, increasing by approximately 31% in the post-CAP with a mean score of 15.76. Furthermore, the project proponents also used the Wilcoxon sign rank test to show if there is a significant increase between the pre- and post-CAP mean scores. Results revealed that all 3 categories have a significance of less than 0.05, indicating that the medians of difference between the pre- and post-CAP scores do not equal to 0, which demonstrates that there is a significant increase between the pre- and post-CAP scores. The project proponents also conducted a Zumba during the culmination to launch the fitness program. As part of social marketing, posters about hypertension were also placed in the Barangay Health Center of Barangay Talay.
The 6-session community immersion has yielded significant insights into the knowledge, attitudes, and practices among the senior citizens of Barangay Talay concerning hypertension. The project proponents were able to build a community profile through the health baseline survey, which reveals hypertension as their top current chronic health condition. Using the Wilcoxon sign rank test, the project proponents were able to reveal a significant increase between the pre- and post-CAP scores, revealing that health teaching had an impact on the knowledge, attitude, and practices of senior citizens in the barangay. The health education, which includes health teaching and social marketing that the project proponents conducted in the barangay, contributed to the community's empowerment in better managing their blood pressure.